America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. 222 affiliates, the latest affiliate to join the America's Healthcare Advocate family, KYST AM in Houston, Galveston, Texas. We're very happy to have them on board in Houston and Galveston. Welcome to the America's Healthcare Advocate family. We are on there on Saturday mornings from 7 a.m. to 8 a.m. We've already gotten calls from listeners there, so we know you're listening. We're happy to have you on board. Also, you can follow us on our website, americashealthcareadvocate.com. That is the website. If you send me an email, if you've got questions or comments, I'm happy to answer them. Also, if you want to follow us on the podcast platform, so you hear a show, you want to tell somebody about it, or maybe just want to go up and see what the latest episode is, they are now posted on 15 podcast platforms. We just picked up iHeartRadio, so it's posted on iHeartRadio's podcast platforms as well. And our YouTube, we post all these shows on YouTube, and our producer, Mr. Dave Thiessen, does all of that, while our producer on the audio side, Darren Wilhite, here at Odyssey, producing all the shows for our terrestrial radio station. So podcasts are up to about 16,000 so far this year. We're pretty pleased about that. And our total YouTube views are 257,000. So a lot of you out there are paying attention to what we're doing on podcasts and YouTube, and we do appreciate it. All right, joining me in studio today, Ryan Roth from Blue Cross and Blue Shield. Ryan, welcome back for your, I think, fifth or sixth show. What did we say?
I think that's right. Yeah,
Something
thanks
like
for having me back.
He's a radio veteran now, folks. He's been doing this quite a while. And Dr. Stephen Castro is joining us today. Welcome, Doctor.
Thank you.
And we're going to talk about SpiraCare today. This is the Blue Cross and Blue Shield of Kansas City primary care centers across Kansas City. There are 9 of them now, right?
That's correct.
All right, so there are 9 of these throughout the metro. We're going to talk about them. But Dr. Castro, he is the Vice President of Primary Care at Blue Cross and Blue Shield of Kansas City. Before starting a Blue KC in May of 2023, he was in Miami, Florida, where he served as the National Director for Gastroenterology. Did I say that right?
Yes.
I actually did. It's impressive, isn't it? for ChanMed. Prior to that, he was Chief Medical Officer at Menorah Medical Center in Overland Park, Kansas, and Chief Medical Officer at Medical City in McKinney at Dallas-Fort Worth, Texas. We're very happy to have him here in the studio with us today. He earned his Master's in Business Administration at Kellogg School of Management, Northwestern University. He is a Doctor of Medicine from the University of Kansas and a Bachelor of Art from Texas Christian University. Welcome.
Thank you.
It's great to have the doctor in the house today. We're going to talk about primary care, why it is important, why 88 million of you out there in the listening and viewing audience don't have a primary care doctor. So we'll talk about the importance of all that. But before we get to that, Ryan, let's just talk about the SpiraCare concept. I was telling Doctor before we started the show today that I remember back when Danette Wilson was the CEO and she rolled this out, and there were a lot of people raising their eyebrows. They were pretty skeptical about whether this was really going to work or not. And here we are, what is this, 7, 8 years later, whatever it is. And it's a big success, and we've got a ton of people in it. So let's just talk a little bit about the overall model and how it works.
Yeah, it's been a very big success for us. Started in 2018, has grown over the years substantially since that point in time to 9 facilities across the Kansas City metro area. And it's really an advanced primary care model where there's additional services offered that you don't typically see with your primary doctor. So in addition to that, it can treat anywhere from newborns to adults and seniors. It is a variety of things for you that you wouldn't necessarily see in a primary facility.
So we're talking about those of us that are chronologically challenged. So now this is available for people on the Blue Cross and Blue Shield Affordable plans?
It is, yes. It's on all our commercial lines. It's on our individual family lines. It's on our Medicare lines of business as well. So we have SpiraCare options in all our segments across the portfolio.
And that's really something, because that wasn't necessarily the case a number of years ago, but now it's opened up across the board for everyone to use. And it's a great opportunity, a great program. Talk a little bit about how the plans are structured, because one of the things that I really like about the way Blue KC did this is it knocks down the barriers to primary care. Right. I mentioned in the opening comment there about 88 million people. Doctor and I talked about this before we went on the air. Just don't have primary care in this country, and it's a mistake not to have a primary care physician. So one of the things, like I said, that I like is SpiraCare gets rid of the barriers to primary care. Talk about that and how the cost of this allows people to access primary care without having to pay high-level copays and all the rest of it.
Sure, absolutely. For any member that visits a Spira center, there is no cost to the member for non-HSA plans. If you are on an HSA plan, it's an affordable cost share per the IRS guidelines. So all those services that we had talked about a moment ago, when you're in a Spira facility and you get services in a Spira facility, no cost to the member. And as you had mentioned a minute ago, it's a wider variety of services that you can have done. It's easy access. You make your appointment. For sick, it can be potentially same or next day if needed. There's expanded hours. So it's really built and designed in a way to service a lot of things and be a source for people, in a variety of different ways.
So how does that impact? Because employers, are using this plan very successfully. A lot of the large employers here in town, the unions and other people, have accessed it, and it seems to be very popular. It's also great for people on the ACA, Obamacare plans, and we mentioned Medicare Advantage. How does that impact when you're literally buying a policy? Does that make these policies more expensive, less expensive? How does all that work, Ryan?
Yeah. These are designed to drive a lower cost of care. And over a period of time, we've tracked it, and it has proved that it typically saves 6 to 8% or drives a 6 to 8% lower cost of care. So if you're an employer offering a group plan, it's very enticing to them because it drives down their cost. But then it's also beneficial to the members too, because when they go in and have a service done, if it's performed within the facility for the non-HSA plans, no cost to them as well. So it's a win for everyone.
So talk a little bit about that, because there's a lot more than just a doctor office, isn't when you go into the facility. There are other things that are offered there. So again, we're back to this no barrier with cost to have these kind of services. Chat a little bit about that, Ryan.
Yeah, there's a variety of services available. So your standard things like sick care and preventative care are covered, but there's behavioral health coaches there. There's coverage for chronic medical conditions. In certain facilities, there's x-rays available, immunizations for the children. There's a whole variety of things, lab draws that are performed there. So a lot of services that you can get all under one roof.
So it's kind of like a one-stop shop for a lot of different things that
really
you can
is,
get done
yes.
in terms of primary care. Are there some prescription meds available through SpiraCare as well?
Not in the facility. No, there's not.
Okay, so those all go out to a pharmacy like you would with any other plan.
That's correct.
So let's kind of go through the locations, because I think it's important people to know where they are. And let's just tell folks where you've got 9 of these throughout the city. There's one. You can find this just about, I don't care where you're at in the metro, there's one of these facilities available, Ryan.
Yeah, since 2018, we've consistently added facilities across the metro area as the demand has warranted. And now we have a really nice coverage across the metro area. So when you're talking in the Northland, we have one in Tiffany Springs and Liberty. Over to the west, we have them in Wyandotte and Shawnee. We have one in Crossroads, which is in the middle of Kansas City Loop. On the east side of town, we have them in Independence and Lee Summit. And then in the south, we have them in Olathe and Overland Park as well.
Yeah, so that pretty much covers the metro. There's one of these almost anywhere that you live within the Kansas City metro. They are easy access. You have everything you need right there in the primary care center, and they work really well. If you want information on them, you can call 833-605-6901, 833-605-6901, or the website spiracare.com. That's spiracare.com. And if you're a broker out there, you really should be taking a look at these in terms of offering your clients a better opportunity with health insurance. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA.
The Golden Rule: treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find us on all 15 of those podcast platforms. If it's out there, we're on it, okay? We're also on YouTube at America's Healthcare Advocate. If you want to go up there and see one of the shows on the YouTube platform, you can do that as well. All right, in studio with me, Ryan Roth and Dr. Stephen Castor from Blue Cross and Blue Shield of Kansas City. We are talking about SpiraCare, how it works, what it is. Their primary care centers are in 9 of them throughout the Kansas City metro, and they offer the access to these centers is available on almost every Blue Cross and Blue Shield platform that's out there. So if you're on an individual health insurance plan, if you're on a Medicare Advantage plan, if you're on a group health insurance plan, if you're on a large group plan, these centers are available in some form on most of those plans. So you've got an opportunity to take a look at these, and it's a better model for primary care. Less waiting time. You can get more done in one place than you can typically trying to get into a primary care doctor. I had to get into mine when I came back off a trip because I had bronchitis. I got an appointment 3 weeks later. So I wound up in the ER. That's where I wound up going. So you can avoid that with SpiraCare. You want to learn more? 833-605-6901 or the website spiracare.com. So before we started the show, Doctor, you and I talked a little bit about there are 88 million people in this country that do not have a primary care physician. So, Doctor, why is that a problem?
Patients who don't have primary care providers tend to get stuck in a fragmented healthcare system. They don't get care when they need it. Some of their chronic medical conditions can get mismanaged. They get duplicate care or their care gets overlooked. They have higher costs and worse outcomes. Having a primary care provider, I look at that team of folks as being the quarterback of healthcare. Essentially, they're managing your healthcare. They're directing you where you need to go. Outcomes are better. Patients get more time with their providers, and the families are involved as well. And so overall, everybody has a better outcome when they have primary care providers.
And so how important is it, you have a primary care provider and you're seeing them on a semi-regular basis, maybe twice a year or whatever it is. The chances of uncovering an issue that you're not aware of, in other words, preventative, how important is that play a role in terms of, again, having a primary care provider and then following through with them?
Preventive care is very important. Again, if you just go to your doctor only when you're sick and they take care of that particular problem, sometimes other diseases may not be uncovered and you might have something that you might live with for a while and not be able to take care of that. So having a primary care provider who's focused on your whole care, your whole body, and be able to be sure that they're managing and identifying conditions that would be very impactful for your care. That's one of the many reasons why I think primary care is very important.
So when we talk about primary care, the other part of this that's really critical is chronic disease management. And Ryan mentioned that, we were talking about what's available at the SpiraCare centers. Let's talk a little bit about chronic disease management. We have an epidemic of diabetes in this country, type 2 diabetes. We've got an epidemic of obesity. We've got, blood pressure. You're on the American Heart Association. I used to be the chairman of the board there, so I'm very familiar with the emphasis there on issues like blood pressure, cholesterol, all the rest of it. Talk a little about how all that fits in when you're talking about chronic disease management and why that's important.
So chronic disease management, very, very important for long-term quality care and outcomes. What we do find is that if you tend to go to specialists for some of your chronic disease management, they might take care of one problem and not take care of your other issues. And so, again, the care tends to be more fragmented. What we find in our Spire Care centers with our primary care teams, they're able to look at the whole patient and able to manage the chronic diseases because you might find that some medication used to treat one disease might impact one of your other diseases you have as well. And so, again, having that quarterback, that provider who's able to look at the whole picture and be able to provide that care is really important. We have some excellent diabetes care specialists at the Spire Care locations, again, helping our patients manage their diet, their medications, being sure that they're doing everything that they can to be sure that they have the best outcomes and best treatment. Our diabetes care teams partner with our primary care providers so that the whole clinical team is involved. Our behavioral health consultants that we have in each of our care centers as well, really important when we are managing chronic diseases because many chronic diseases have a behavioral health component. And so separating those, again, reduces the patient's ability to get well. And we found that the behavioral health team is critically important for our model and definitely improves outcomes when it comes to chronic disease management.
So let's go back to that for a minute. That was interesting. You said chronic disease management and chronic diseases, some of them have behavioral health issues. Explain that a little bit. Talk a little bit about that.
Sure. For many chronic diseases, diet is very important in the management of that. Exercise, your weight, your medications, all those things go into play in trying to manage your diabetes. So a lot of behaviors, the way you eat, the way you exercise. There's some patients who don't like to take their medications, and again, having the team of people to help you understand the why behind all the things that your provider is recommending to manage your diabetes, I think it just reinforces the story and the education that the rest of our teams are providing.
And that we go back to that comment. It's interesting. You called the quarterback. This is when you talk about fragmented care. You go see. My wife's got some significant heart issues, etc. And she's got a great primary care doctor, but she's got 2 or 3 different doctors that deal with this heart issue, but all that information goes back to one place. And so there's a central facility or a central place for all that is. And if medications are being changed by this doctor and that, how critical is that so that people don't do that they don't go see a specialist? You don't have a primary care doctor, so this specialist prescribes this and this specialist looks at this. Maybe they don't know what you're taking. Those kind of interactions can be pretty significant if it's not being managed, right?
Yes, and definitely, there's some conditions that certainly need to be managed by a specialist. But again, having that primary care physician or provider, being able to look at all of the notes, understand where you've been, if you were just in the hospital, and they were able to get information, again, help you kind of manage that, keep you out of the hospital. Being sure that none of the medicines that you're taking need to be changed or adjusted. And so having that whole view, kind of the 10,000-foot view, if you will, of your medical care is just critically important for patients to be sure that they're going to have really good outcomes and have their diseases well managed.
Yeah, and if they don't do that, it's not going to happen.
Right.
And then you have bigger problems down the road.
Right.
Ryan, before we go to break, we talked a little about specialists here. Talk a little bit about the care guides at the Spire Care facilities that help. For instance, they see doctor says you need to see a specialist for this particular issue, that issue. Talk about how they help people coordinate that, because oftentimes that can be very frustrating. Who do I go see? How do I get in? How do I know whether this doctor is the one I need to see, or is there a better doctor? Talk a little bit about that and how that's coordinated at Spire Care.
Yeah, and that's a big advantage of Spire Care. Spire Care is designed to give patients the time and attention they need for their care. So there are care guides available that are sitting down and working with the member, helping them throughout the process and kind of quarterbacking, as Dr. Castor said, the care and where you might need to go for other services.
And that all comes together under SpiroCare. If you want information on SpiroCare, the phone number is 833-605-6901 or the website spirocare.com, spirocare.com. Stay tuned. We've got more of the doctors in the house. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer behind the microphone, Mr. Darren Wilhite. Behind the camera, doing all the video work, Mr. Dave Thiessen. In studio with me, Ryan Roth and Dr. Stephen Castor from Blue Cross and Blue Shield of Kansas City. Our topic today is primary care, but we're talking about primary care that's offered by Blue Cross and Blue Shield through the 9 different SpiroCare clinics they have throughout the city, primary care centers throughout the city. That's what we're talking about, how you can access all of your primary care needs at the SpiroCare centers. It's really quite different. It's very efficient. It's a lot easier than trying to get into your primary care doctor. You know, the average amount of time, and I'm going to ask the doctor this question, but the average amount of time you get from a primary care physician in a typical hospital practice, 7.5 minutes. It's a little different at SpiroCare. We'll talk a little bit about that. If you want to learn more about it, 833-605-6901 or spirocare.com, spirocare.com. So let's talk about that real quick before we get into this other topic. You know, the thing about SpiroCare that's really different in terms of the physicians and the nurse practitioners is they have time. So talk a little bit about, because that 7.5 minutes is a real number. And when you think about that, that's not very good.
We believe that's the key to the success of our SpiroCare model, is the time that our providers and teams do have to take care of the patient. We have up to 45-minute slots for patients to really take time to talk with their provider. When there's different, if you're sick, you can, you don't just have a 7-minute visit. It tends to be much longer than that. As far as access goes, you had mentioned that earlier. With the SpiroCare model, we are available to get patients who are sick, usually within with 1 to 2 days, to get in to see us, again, to prevent them from having to go to the emergency room or the urgent care. We even have regular appointments available for new patients. So many times, if you're a new patient to SpiroCare, you can get an appointment with one of our providers within a week or so. So
a couple things that are interesting. Number one, you've got virtual available too.
Yes.
So if you can't get in that day, but you absolutely need to, they can do a virtual care with SpiroCare, and the doctor's right there going through your symptoms. If you need to have a prescription done, the doctor can do it. You can go pick up the prescription. So that's another option that's available, right?
Yes.
Yeah. And I think the convenience of it is one of the things that's really different. The other thing I think is interesting, I've talked with other doctors in this situation. Having the time to be with the patient, you get to know the patient. In 7.5 minutes, you're not going to get to know people very well. Okay, so how important is that to get to know the patients? The patient has time to talk to you about what their issues are.
Yes, and we talked about a little bit earlier about how sometimes things don't get discussed with your primary care provider if you don't have the time. And so certainly most patients, come into their provider with 1 or 2, main concerns. And oftentimes in a traditional practice, that's all that gets addressed. And so having that extra time to really have the primary care provider really dig in to maybe some symptoms that you weren't aware of even that might have had some significance for your care. And not only you, but your family. Many patients bring their family in to speak with their providers as well. Again, having that extra pair of ears to listen, to understand, what needs to be done is very helpful. And I think, again, having that time to really allow those extra long conversations are really impactful.
You said something interesting there. For those of us that are chronologically challenged, oftentimes our children, my daughter goes to every doctor's appointment my wife has. Okay, now obviously she has a heart condition issue, but it's important for them to be involved, and that's one of the things you're saying that, SpiroCare lets them, if you've got an 85-year-old mother or 94-year-old father, and they've got medical issues, whatever the case may be. In my case, my wife and I are 74. My daughter wants to be there. She wants to know what's going on. So that's really important to help you as the physician and the patient, and if there's somebody else involved, manage that care.
Yes. And again, as we talked earlier, for many chronic medical conditions, there's medications involved. There's a lot of times dietary changes and other lifestyle modifications that, again, very helpful when you're providing a lot of information to patients to have that extra pair of ears there to be able to help ask questions and just be sure that everything was understood so you have the best outcome.
Yeah, that's really interesting because a lot of these appointments that we go to where Andrea goes with us to the appointments, when we walk away, what she heard, what we heard can frequently be somewhat different, and a lot of times what she heard is a little more accurate than what we heard. It's really kind of interesting. So that is important, isn't it? Especially when you're talking about those of us that are seasoned citizens and you have more medical issues as you age. If you've got family members involved, that helps in the situation, does it not?
It does, definitely. And again, with the Spira model, having our multidisciplinary team, most likely if you have a chronic medical problem, you're going to be seeing multiple different members of our clinical team. Again, all those clinicians will reinforce what your provider has been telling you that you should do. And so the care guide, if you have diabetes specialist, all those folks are just going to continue to reinforce what your plan of care is so that you have the best outcome possible.
So the question, and this is kind of interesting, if you have, you're a parent or your parents, you're with your parent, going to these appointments, whatever the case may be, and let's say, for instance, you are, the parent is 90-some years old, you're going with them to make sure maybe they're type 2 or type 1 diabetic. That information can be shared with the person that is the caregiver that's overseeing their care, as long as the patient's giving permission for that information can be shared. So when you talk about management, especially of things like diabetes, taking that insulin, getting the A1C, how important is all that, especially as you get older, trying to keep all of that under control?
Yes, definitely. I mean, every chronic disease has its unique features, and it's different for every patient as far as the treatment plan, as far as details go with that. And you add several chronic medical conditions onto one patient, and it gets very complicated. And again, I think that's one of the advantages of the Spira Care model is healthcare is really complicated, even in the best of times. And so having a multidisciplinary team who takes time to be sure that they answer all your questions and be sure that you are moving in the way that your doctor needs you to go.
And then, the other piece of this that's kind of interesting is we're kind of going down the path here. Ryan talked about in that last segment real quickly about coordinating with specialists. If you're the child, okay, and it's your mother, your father, your grandfather, whatever the case may be, trying to set all that up to get them to a specialist for this issue, how important is having someone to help them navigate? You talk about confusing. That gets really confusing. How important is it to have that care guide navigator there to help the caregiver that's the child, okay, deal with those issues with their aging parent?
Yeah, we get a lot of really great comments back from our patients about our care guides and that care that they're able to provide. Again, knowing what your out-of-pocket cost might be to go see a specialist or get a service, who's in your network, who you can go to, and then just help you get that appointment, help you navigate all that complexity, and again, be sure that the child is able to get off work to go with the patient to the appointment. All those things are critically important, and a lot of ways that it can break down in the process along the way. And so having those care guides that we have at Spira Care are critically important for the success of our patients.
And Ryan, the Spira Care is available now on the Medicare Advantage plans?
That's correct.
So
in fact, on the Medicare Advantage plans, all our Medicare Advantage members have Spira Care available to them. So it's not just picking a particular plan. All of them include Spira Care on Medicare Advantage.
And that's different. because that wasn't that way several years ago. Right. So that's a big improvement now that it's available to everybody out there. You know, the reason why we kind of went down the path there, and this was actually, we weren't even going to talk about this in this segment, but once we got started, I thought it was interesting. You know, we have this issue in my family. You know, my daughter always comes to these appointments that my wife's involved in, and I know that a lot of you out there are in that sandwich generation, and you're dealing with these issues. This is one of the advantages to SpiroCare. You heard Doctor talk about 45 minutes to sit down and understand what's going on. If it's your parent and you're going to those appointments, you can understand what's happening medically. You can also understand how to help them manage those issues. Type 1 diabetes, type 2 diabetes, or heart issues, or other chronic issues that they're dealing with. This is all part of that package of what they do, and they do it differently, and they deliver it differently. And that's the thing that I think makes SpiroCare so different. So if you are in that sandwich generation, you've got that mother, that father, that grandmother, whatever the case may be, and you're dealing with these issues. I talked with somebody the other day that was dealing with the parent, and they were pulling their hair out. Okay, and I said to them, you really do need to take a look at SpiroCare because it's going to make a difference for you. That's the difference in the way this works. So if you're interested in it, 833-605-6901, 833-605-6901. Call them. You can go down there, take a tour and see what it's like, or online at spirocare.com, spirocare.com. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Shows are posted on all 15 podcast platforms and on YouTube, as well as broadcast across the country on our 222 affiliates now. Our newest one being in Houston, Galveston, Texas. Very happy to have those folks on board, and that would be KYST-AM. Houston, Galveston. Very happy to have them on, and welcome to the America's Healthcare Advocate family. If you want to learn more about SpiroCare, the phone number 833-605-6901 or spirocare.com, 833-605-6901. I'm going to read you a little testimonial here that kind of follows what we were talking about in that last segment. You're going to find this interesting. I just cannot leave without saying thank you for all your help and kindness during this incredibly stressful year. You were great. You were a great help in getting my medications figured out and a safe place for me when I needed it. SpiroCare is in a class of its own when it comes to quality care, compassion for the patient, and dedication to give you their best. You know, if that doesn't say it all, I don't know what does. Okay, that's an example of what I'm talking about here. That's an example of the difference between the way that SpiroCare does this and what you get in 7.5 minutes at one of the large hospital-run primary care practices. It is significantly different. And there are more of these testimonials. But the point I'm making is, you know, if you're that person out there that's looking for a better experience in primary care, you really do need to take a look at SpiroCare. Once again, the website, spirocare.com. There's a lot of information up there. There's testimonials up there, information on their doctors. It's all on the website. Go take a look at it. There are 9 locations throughout the metro, so there's one near you somewhere if you choose to go. All right, so let's now talk a little bit about this clinical pharmacy program. You rolled this out last year. Let's talk about that. You rolled it out in July, I think, didn't you, Doctor?
Yes.
So let's talk about that.
So, as we talked about, we have a multidisciplinary care team. We have the physicians, advanced practice professionals, diabetes care managers, behavioral health consultants. And the more recent addition to our clinical team has been a clinical pharmacist that we have in the SpiroCare program. And so what we had realized and what we had gotten a lot of comments from patients about is that needed some additional support in trying to understand their medications, potential interactions with the medications, and so that's what we started this program. So what our clinical pharmacist does in SpiroCare is she actually meets with our patients and helps them understand the medications they're on, and we especially noticed a big impact for patients who were just recently discharged from the hospital, because as many of you know, when you go into the hospital lot of times your medications get changed, dosages get changed, you get sent home with new medications that you don't really understand. And so what our pharmacist does is she actually meets with these patients who were just recently discharged from the hospital, and she goes through all of their medications with them and be sure they understand why they're on those medicines. And not only that, but she also evaluates to be sure that they're on the right medicine, that they're on the right dose. And she talks to their provider to be sure that they don't need to have any adjustments made in there. Because studies have shown that patients who get discharged from the hospital a lot of times will get readmitted for the same problem, and a lot of times related to medications. And so we feel this has been really impactful for our patients to keep them out of the hospital and to be sure that they're continuing to recover from the condition that put them in the hospital in the first place.
That really is interesting because you don't really think about that. When you think that you're hospitalized, you come out, you leave with a bag of medications typically, okay? And then you get home and it's like, well, here are the ones I was taking before I went in a hospital, and here's the new ones they gave me, and what am I supposed to do? And then I go back to this comment by the person that wrote this testimonial, you were a great help in getting my medications figured out. It's confusing to people, is it not?
Very confusing, very confusing. And so, again, with our patient-centered approach that we approach every patient, again, we want to be sure that our patients have all the tools and resources that they need to be sure that their problems are well managed. So really excited about the impact that our pharmacist has had at SpiroCare.
Yeah, and again, that's just another piece of something that is significantly different here. You're not going to get that at a typical primary care practice. It's just not available. Okay, but and I'll go back to this sandwich generation thing. We talked about in the last segment. If that is your mother, your father, your grandmother, whatever the case may be, and you're the one that's overseeing that care, being able to sit down with that pharmacist and get a clear understanding of, well, should Dad be taking this now, or are we taking this now? What about the ones he had before versus the new ones that he's got now? That it gives you kind of a roadmap, doesn't it?
Definitely does, and our pharmacist also does virtual visits as well. So again, makes it more convenient for family to join in when they're having conversations with the patients about their medications.
So if there are problems that arise after they go home, whatever the case may be, or just problems you're having, on an ongoing basis, there's an opportunity now to connect on a virtual basis and have that conversation.
Yes,
that's different. Okay, that's really different. When you think about it, especially, and I keep going back to this because as you age, if you're chronologically challenged, you have more meds. Okay, and it can get confusing and well, I'm having an issue. Should I continue to take that blood pressure medicine? I'm lightheaded. My blood pressure is fluctuating. What should I do? Having somebody that you can talk to about whether you should continue the valsartan or do something different or reduce the dose, that's a big deal.
And then also the advantage too is that when you have a primary care provider who knows you and knows your family, has been taking care of you for a while, those interactions with our clinical pharmacist and the patient and the provider provides a really cohesive way of providing care. And definitely patients appreciate it, and we believe it produces better outcomes and ultimately, lowers total cost of care.
Yeah, and meds play such a big part in day-to-day healthcare these days. I mean, 25 to 28% of the total cost of healthcare is dedicated to medications. Okay, and so then the other question becomes, taking things that are not necessary or things that you should be getting off of and adjusting. That's all part of how this all works, isn't it?
Yes, and that's what the pharmacist looks at. Again, be sure you're on the right dose, be sure you're on the right medicine. Is there something else that might potentially have a bigger impact and provide better care for you? And again, always, having that collaboration with the primary care provider during this whole process really makes it seamless for the patient and definitely better outcomes.
Yeah, again, like I said, it's just, the difference here of what's being offered versus what's typically being offered in primary care is significantly different. Another piece of what makes SpiroCare so different, and that is behavioral health. And we have a lot of problems with behavioral health in this country. There's a mental health crisis, if you want to call it that, in this country. If you don't think that, just look around at what's going on around us. And I'm talking about all ages, from young people, teenagers, all the way up to people that are senior citizens, whatever the case may be. So when this model was put in place, one of the things that I was most impressed with was including behavioral health in the facility right there. It's not you're going to get referred to go to a behavioral health specialist, doctor, clinical caregiver, whatever the case may be, and then maybe you'll make the appointment, or maybe you won't. Okay, and it all kind of drops off. So just talk about the model to start with.
Sure. The integrated behavioral health has been a vital part of the Spira model for some time because we realize that there is a definite link between physical and mental health for a lot of issues. We definitely know that, as we talked about previously, the behavioral health issues are very important to address when somebody has chronic medical problems. And then we also find just having those behavioral health clinicians in our centers, we're able to provide real-time treatment and evaluation for depression, for anxiety, anything that the patient may be going through. I hear frequently from our clinical teams that we have patients that may come in for their routine follow-up appointment, and as they are spending time talking with their provider, understand that they had a significant life event, with death, somebody died in their family, or they had some other significant issue that they were really struggling with. And so we call it a warm handoff. Essentially, the primary care provider, when they're finished with their assessment, will then take them to our behavioral health consultant. They'll spend 15 or 20 minutes just kind of talking about that life event that they had that they're struggling with. And so the patient didn't even realize that they were going to have that evaluation and service when they came just to see their primary care provider, but they leave obviously in a better place from a mental health well-being perspective, and so really has a big impact on our patients, and again just provides that extra care that helps our patients live better lives.
Yeah, and you said something interesting there, and make sure the audience caught this. They have the time to talk to them. So we're back to this time issue with the primary care doctor. So the primary care doctor's got 45 minutes now, right? Or whatever it takes, all right? And you're talking to some, maybe it's somebody that is, a seasoned citizen and they lost a spouse. There's been a death in the family, okay? And how are they adjusting? Are they withdrawing? Are they not being, are they not socializing? Are they shutting down? Because that happens. And it's a real problem when it does happen. Okay, are they not paying attention and taking their meds? Being able to walk over and say, introduce the person, have some counseling, have some discussion, can make a huge difference, can it not?
Definitely, and again, something that during a 7-minute visit that might not ever come up, as they're focusing on your main medical issues. So yeah, I think we definitely know that that's a huge benefit for our model, and definitely something that we're very proud of.
Yeah, it's interesting too, because I'm a veteran. I'm a Vietnam veteran, and the PTSD thing is a big deal. And a lot of veterans don't want to talk about this. They don't want to deal with it, et cetera, et cetera. And the problem with that is the longer it sits there, the more difficult it becomes over a period of time. And, Blue Cross and Blue Shield has got plans now for veterans on the Medicare Advantage side. Having access to somebody for issues like for first responders, former military people on this PTSD thing. How important is that? To have that and get it on the table and start doing something about it. I went through a series of therapy programs, made a big difference, but it took me a long time to do it. 35 years after I probably should have done it. Okay, but so how important is to have that piece there for that warm handoff that you just talked about?
Definitely. And I think, as you mentioned just a minute or two ago, a lot of times when you have an issue, you have to wait. If you're trying to see an outside provider, you have to wait a couple weeks or longer, sometimes several months to get in, and just what a difference it makes in patients' lives when you can get those issues addressed immediately during that visit, as opposed to having to wait several months to have that initial visit and just everything that could go on, between that time. So So again, I hear a lot of great things from our clinical teams, being ahead of the organization. But one of the things that really touches my heart a lot is the behavioral health side and with the impact that our clinicians have in really making that immediate change and impact for our patients before they leave our care center.
It's huge because I'll tell you, in my situation, I was at KU and I was supposed to go back to KU and I couldn't. I just didn't do it, and I went out and found a private provider and I paid cash. But a lot of people can't do that. And if it's available under SpiroCare and it's right there, you don't have that issue to deal with, and it can make a big difference.
Definitely.
Yeah, so I just think it's important people understand that's there in all walks of life. Whether it's young people who are dealing with these issues, we see these kids dealing with a lot of stuff, all this online social nonsense that's going on out there impacting kids, or whether it's parents, or whether it's, like I said, somebody's mother, grandmother, whatever the case may be. Having it as part of SpiroCare is a big deal. And it's available at all of the facilities.
Yes, so all of our 9 care centers each have their own behavioral health consultant who are available to take care of any of our patients that need that help.
Ryan, let's go back real quick through the plans that this is offered under. We can start with the Medicare plans, the Medicare Advantage plans. Let's talk about those, and let's go into the ACA and then the group health insurance plans, right?
Yep. So we have SpiroCare plans available in all of our segments. So as you had mentioned, Medicare Advantage, there is options for SpiroCare coverage. The Affordable Care Act plans, there's SpiroCare available on the gold, bronze, and silver levels. So all 3 of the levels included. In group coverage, small and large group, we have plans available. So it really covers the spectrum. And what we find is people are a little hesitant at first. It's something different than they're used to. Then they get familiar with it, get used to it, and they don't want to give it up. So they can go from a group plan, and then they need individual coverage. There's still a plan available. Or they retire and want to go to Medicare Advantage. There's still plans available. So it really covers the full spectrum.
Yeah, and so what it does, doctor, is it's a continuity of care. Correct?
Yes.
Yeah. So the doctor knows the patient knows they're going to go see the same familiar face. It's not a rotating, constant change of who you're going to deal with and who you're going to see, and that's really kind of important.
It's very important, and actually scientific studies support that continuity of care with your provider, people have better outcomes. So everybody wins with that.
Thank you both. It was a good show today. It was great to be able to get this message out. Thank you for coming up, Doctor. I really appreciate the time.
Thank you for your invitation.
Great show as usual. I'm going to relate a little story here. Years ago, when this first started, I was with a broker who we were heading to Arkansas to meet with some folks, and he was talking about a group he was having a lot of problems with, and I said, you need to take a look at SpiroCare. He didn't know what it was. He did. 2 months later, he was so impressed with what happened, he enrolled his entire agency in SpiroCare. You heard Ryan just say people are a little hesitant sometimes. Once you do this and once you try it, I can almost guarantee you're going to be happy with what they do. It's just very different, okay? It's a personalized level of care that you just don't see much anymore. And it's an opportunity to provide better care through primary care for your whole family, whether it's a mother or father, whether it's your children or whether it's you. This can make a big difference. If you're an employer, it can make a huge difference for you, both on the cost side as well as on the satisfaction side for your employees. The phone number is 833-605-6901. The website, spirocare.com. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Goodbye, America.